Hello, my name is Dr. Marit Harden. Welcome to Marit Harden Ministries, my online training and teaching presence. I'm going to be just sharing a little bit about myself as an introduction, because I want you to know about my background and my training for why I'm here today to share what I have learned over many years. So I'm a medical doctor. I have trained in basic medicine and surgery training back in the 1980s. And I have worked as a general practitioner, a medical doctor, family doctor since 1990. In the year 2005, I did extra training in something called cognitive behaviour therapy. And cognitive behaviour therapy has become my focus in therapy. So now most of my work clinically is with patients with anxiety and depression using cognitive behaviour therapy skills. Today I am going to share a little bit about the basis of cognitive behaviour therapy, where it came from, how it has helped people over many years, and how it has a lot of scientific evidence and research backing to show its benefits for individuals in lots of different situations. So not just depression and anxiety, but also as a life skill that you can use as a parenting skill, as a skill for chronic illnesses and even chronic pain. Into this mix over the last 15 years, I certainly have been using mindfulness skills as well. So at times I will be giving a little bit of extra information on how mindfulness can be used to influence those situations where we get a little bit stuck. And I'd also need to point out that I'm a Christian, and my Christian faith informs a lot of my therapy skills. It informs my background. It informs how I sort of process life. And I'm hoping that as you share and look through these videos and maybe do some of the exercises, that you'll get a chance to test this stuff out for yourself. I know that cognitive behaviour therapy skills work best when we take them out into the real world. It's not just head knowledge, it's actually about heart knowledge. It's about something deeper than just knowing the information to answer a question on a quiz. This is about practical stuff that we use in our day-to-day life. And if we don't take it out into our real world, yes, it will stay as head knowledge. It might be something that you might get reminded of down the track if you haven't actually taken it there. Some of my patients and clients do the cognitive behaviour therapy training for 6 to 8 sessions, and then they go away, and maybe 3 or 4 years later they come back for a refresher, because this stuff does need to be reminded. And sometimes we're not quite ready to use all of the skills. We may only use 1 or 2 of the skills. So going back and revisiting these lessons is a really important step. And it's okay to do that. It's not one of those things where you've learnt it once, then you should be able to put it aside and always remember it. It's often helpful to revisit this stuff. Today we're going to look at the background of cognitive behaviour therapy, which I believe is a very powerful tool for use with lots of life situations and mental health disorders. And I'm going to just give you a little bit of a clue about its background and how it came to be. Back in the 1960s, an American psychiatrist, Dr. Aaron T. Beck, came up with this concept that was looking at the negative thoughts of some of his depressed patients. And he found that they were in 3 different areas. They were negative about themselves, they were negative about their world, and they were also negative about their future. And he started to challenge their negative ideas, and he called these cognitions. These are the thought processes that they were having. And he found that when he was able to challenge those ideas and the beliefs associated with those ideas, some of his depressed patients started to get better. I also have heard that Dr. Beck was training to be a psychoanalyst, and as part of that process, his application to the American Psychoanalysis Society was rejected, unfortunately. And his process with cognitive distortions that his depressed patients were having basically forced him into making cognitive behaviour therapy as an alternative way of giving therapy from the previous psychoanalysis model. Now, I need you to think about this, because cognitive stuff is thinking about thinking, and it is very much stuff in your head. And I need you to also to think that our heart, our place deep in our emotions, does actually impact how we learn about things. We learn best when we have a heart engagement. So I need you to start to think, as you are processing this beginning process of cognitive behaviour therapy, that you'll notice that when something tugs at your heart, gives you an emotional response, that is something to pay attention to. So, firstly, head knowledge. We can learn in lots of different ways. Reading stuff, hearing stuff, going to lectures, watching movies. We're always learning. Our head is taking information in. But when we get a heart connection, when our emotions get included in that learning, it becomes a stronger learning. So just think about that for a bit. Now, cognitive behaviour therapy is labelled CBT for short. And I'm just going to put those things up here on my whiteboard. C for cognitive. And obviously we also have a B for behaviour, because it is actually a behavioural therapy. B for behaviour. And the T is therapy. And it is just as therapeutic as taking antibiotics for an infection, splinting a broken bone. It is just as therapeutic as coming and putting a bandage over a wound, cleaning it up. But a lot of the CBT skills that we're doing are therapy for the soul. It's a balm for our soul to be able to process some of our thoughts and actually reject some that have come into our minds and we've gotten stuck thinking a certain way. It is therapy to be able to forgive yourself and to move on. It is therapy to be able to process information in a new way and accept a different way of looking at the situations and the circumstances of life. So cognitive behaviour therapy starts with thinking. It does look at our behaviour, and it is therapeutic. Cognitive behaviour therapy relies on a triad that I'm going to explain to you. Firstly, I will put our feelings. So whatever you're feeling in a moment interacts with our thoughts, and our behaviours. So what happens when we get a feeling in a situation? It drives a whole lot of thoughts. At the same time, that feeling drives a whole lot of behaviours. And we know that there is actually an interaction between our thoughts and our behaviours, and also sometimes our thoughts drive a certain new feeling as well. So we know that all of those parts can go in all directions. But when we get a very strong feeling, a feeling that is part of the strong motivations to think a certain way, and we start to think a very negative thought pattern, this is something we call rumination. And I'm going to put that in here as rumination. When we think and review a memory and we revisit the words that were spoken and we think about how we might have done it differently, that process, driven by a feeling with a whole lot of thoughts, is a cycle that keeps us stuck. And similarly, sometimes when our feelings drive a behaviour, so in depression, a lot of people feel very, they want to isolate themselves, they cut off their connections with people, they go quiet, their activity is reduced. Those are behaviours that are driven by the feeling of being low, a low mood. And those behaviours are what I call a reaction. They are reacting to that feeling. So we call that a reactive behaviour. And when we react like that, again, it emphasises and strengthens that feeling. It makes that feeling take on a role of being the one that chooses for you how you're going to think and behave. And I call it putting a crown on your feeling. Can you imagine what happens when our thoughts and our behaviours are always just in response to a feeling? Now, it doesn't mean that our feelings don't have a place in life. Our feelings are given to us by God, and God is a God that feels things as well. If you look through the Bible, there are lots and lots of situations where God expresses a feeling. And it is appropriate to have feelings, and the feelings are there for a reason. They do give us a motivating strength or a force, but they shouldn't be the only thing to make your decisions. So with cognitive behaviour therapy, we try to de-emphasise our feelings. We make them a part of life, but not the main thing, not the thing to make your decisions for you, and not the thing to drive your thinking in your day-to-day processing. CBT, the training in CBT, is cognitive. We're thinking about thinking. It is behavioural, so we are looking at how we act in response to the things that we're going through. It is therapy. It helps us by being a balm for our soul. It is based on this triad of feelings, thoughts and behaviours, where we recognise that our feelings have become a driving force for our thoughts, and we get into a cycle of rumination, or we get into a process of being reactive because of our feelings. So this is my introduction to cognitive behaviour therapy with a Christian worldview. I have a manual that will go with this program so that you can sort of read some of the materials as well, and there will be some skill type practical activities that you can do, but I'm not going to be giving you a pass or a fail. It's not a school-based thing, but if you are using these skills for other people as a therapist yourself, then you might like to pick and choose some of these skills that are being presented here in your own therapy. Love from the centre of who you are. Don't fake it. Run for dear life from evil. Hold on for dear life to good. Be good friends who love deeply. Practice playing second fiddle. Don't burn out. Keep yourself fueled and aflame. Be alert servants of the Master, cheerfully expectant. Don't quit in hard times. Pray all the harder. Help needy Christians and be inventive in hospitality. Bless your enemies. No cursing under your breath. Laugh with your happy friends when they're happy. Share tears when they're down.